While it may be cold outside, things are getting toasty warm at Global Voice Broadcasting. Heat up your winter nights with the hottest topics, the hottest celebrities, and today's best music. It's why Global Voice Broadcasting is becoming your 24/7 home for the music and talk you want right now. Discover your favorite shows and music anytime at globalvoicebroadcasting.com.
I highly recommend Ms. Hicks. Her books, her CDs are encouraging.
I bought her book, A Hill to Climb. She's a very inspirational speaker.
And I look forward to one day being able to work with her.
Your power lies within you. Let it loose.
Aspiration, inspiration, motivation, edification, determination. These are the keys of life success brought to you by none other than award-winning author, motivational lecturer, business consultant, and much more as she gets you aimed to your purpose. And now, ladies and gentlemen, young and elder, from Hollywood to the entire world, here is your host of Aim to Purpose, the radio show, Louise Hicks, along with her co-host, yours truly, Kenan Wesley Mason.
Hello, world. How's everybody today? And I'd like to wish everyone a happy new year. And I do apologize for my voice. I suffered a little case of laryngitis over the holiday, but I'm here.
And you sound fine.
And we have, well, Kenneth says I sound fine, but I'm Louise Hicks, your host of Aim to Purpose, and welcome.
And I'm Kenan Wesley Mason, and welcome and Happy New Year to everyone around the world. It's great to be back here in the studio to start 2015 and to start it in a great way after everyone has partaken in all the holiday cheer and festivities and eaten all of the food that they can muster up.
That's for sure, because I know I ate my share. But the beauty of it all is we're starting at the beginning of the year, and we wanted to start off the year on a healthy note. Therefore, we've brought in a very special guest so that he can assist us with getting off to a healthy start. And
Yes.
that's Dr. Caldwell B. Esselstyn Jr.
Yes.
And he's going to share with us a lot of information. We're going to go into the forks over knives, our topic for today. And we're just looking forward to speaking to Dr. Esselstyn. But first, we have to give our community news. Go ahead, Ken, and introduce our community and entertainment news commentator. And then we will get right into Forks Over Knives, Preventing Heart Disease with Dr. Esselstyn.
Yes, and before we do that, we are going to go into our entertainment and community news with the one and the only Shamika Brown.
Hello, everyone. It's your girl, Mika the Diva. Happy New Year to all my fabulous people out there. So excited that we are back with for 2015, a new year, new exciting stuff going on. So I'm going to jump in right to it. You know, I always give you the box office numbers from the previous weekend. And who we have coming in at number one is The Hobbit, The Battle of the Five Armies with $21.9 million. Number two is Into the Woods, $19 million. And Unbroken at number three with $18.3 million.
Wow.
Yeah. And so clearly everybody was hanging out at the movies. International numbers, The Hobbit back at number one, $89.2 million for international.
Wow.
Number two, Exodus, Gods and Kings, $31 million. And Night at the Museum, $31.3 million. Were you guys able to check out any of those movies?
No, I didn't.
I wasn't. I was suffering with whispering.
Right. Well, as always, you guys hit us up on Twitter at Aim to Purpose. Give us your feedback. Let us know if you check those movies out. We're definitely looking forward to seeing how those numbers kind of, grow
Yes.
as time goes on. So listen, I have some upcoming releases I want to tell you guys about for January 9th, this upcoming Friday. Taken 3. That is the action movie trilogy starring Liam Neeson. This time around, he's an ex-government operative and is accused of a ruthless murder he never committed. And so he's trying to track down the real killer so that he can clear his name. And also starring with him is Forrest Whitaker. So good to see him back on the screen, right? So
that should be interesting.
Yeah, I'm going to check that out this weekend. And then Selma. Selma is a docudrama about, it chronicles Dr. Martin Luther King's campaign to secure equal voting rights via an epic march from Selma to Montgomery, Alabama. So you guys know your history. That's pretty much what the movie is about. But we have David Oyelowo, excuse me if I'm not saying that right, Oprah, Carmen Ejojo, and Tim Roth. They're all starring in this. It's just a star-studded film, but, you know, again, and because Dr. King's birthday is coming up, I think this would be a really good film to take the family. Oh, yeah. Go ahead and kind of revive them and re-energize them on what it means, you know, how far we've come with the civil rights. And I know that that's something that we talked about last year, just all of the stuff that was going on and just how important it is to, you know, just kind of be aware and have your voice heard. So check that film out. And it's also directed by Ava DuVernay. So really, really love her. Go out and support that film, guys.
Right.
Okay. And then for some sad news coming out of Hollywood, actually, ESPN's Stuart Scott, he died of cancer on Sunday. And we just want to say rest in peace, rest in paradise. I like to say rest in paradise. And, you know, blessings to his family.
Yes.
But the prominent SportsCenter anchor, he died at age 49 after a long bout with cancer. We are not privy to the information as to what type of cancer it was. He was diagnosed in 2007. And he was known for his trademark "booyah!" exclamation, narrating the plays night after night on SportsCenter. And
he was pretty much the flagship of SportsCenter and ESPN.
Colorful correspondent. I mean, you know,
I remember him
synonymous.
well. He was really, really a great guy from what I saw him because I love sports too.
Yeah, really big blow to the sports community. And just last year, he was honored at the ESPY Awards for the Jimmy V Award for Perseverance. And at that time when he accepted the award, he told the audience, when you die, it does not mean that you lose cancer. You lose to cancer. You beat cancer by how you live and why you live and in the manner in which you live. So we think that he did his job with such grace.
Yes.
And so he will truly be missed.
Yeah, I know ESPN will definitely miss one of the great voices amongst ESPN. He didn't talk about his cancer too much, but you know, I mean, it's still sad. Which another reason why I'm happy that we have our guest here today, because it's kind of a good segue to go into for preventative purposes.
Yes.
With cancer, heart disease in this case, with Dr. Esselstyn is that's where his expertise and research lies. So that will definitely be a big loss, but ESPN will always bounce back as they always do. So
yes. Yes, definitely. And then one more thing that I wanted to mention, we do have the People's Choice Awards and the Golden Globes coming up. It is award season, people, so I know everybody's going to be looking to see what films made the cut, and you have just so many phenomenal projects out there that are being nominated. So you can catch the People's Choice Awards on January 7th at the Nokia Theater, broadcasting on CBS, 9 Eastern, 8 p.m. Central. Golden Globes on January 11th, broadcasting from the Beverly Hills Hotel at 5 p.m. Here in Los Angeles on NBC. So look out for that. Just wanted to throw that in there as far as events are concerned. But again, rest in paradise to Stuart Scott. And are we taking a break, or are we just going to kind of roll into it?
Well, we're going to take a quick break, and that way we'll have no interruptions talking to Dr. Esselstyn. So let's go into a quick break, and we will be right back.
Okay.
Hey folks, it's Ken here. If you or someone you know around the world has a small business, organization, or foundation you'd like to share with the Aim to Purpose audience, showcase it here on our segment of the show called Small Business Monday. The opportunities for people around the world to browse, buy, and use your products and services are endless. We pre-screen all businesses, organizations, and foundations for legitimacy, but because this is a free community service brought to our audience, it's at no cost to you as well. You heard it right. It's absolutely free, and you don't have to pay 1 penny. How do you like that? You just come on down to the studio and tell the story of your business, organization, or foundation, and give it the praises and accolades you know it deserves. If you're in another part of the state or country, or if you're in another part of the world, you can easily call in or Skype in and do the same. So what are you waiting for? Contact the show's publicist, Shamika Brown, at www.divinebrownmedia.com. She can also be contacted at 1-818-533-8463. Or contact Louise Hicks at www.louisehicks.biz. She can also be contacted at 1-562-310-1495. Allow yourself to be seen by the global masses and allow your business to shine and grow because of the global masses. It's Small Business Monday, courtesy of Aim to Purpose, the radio show.
Hello, world. We're back again. I'm Louise Hicks, the host of Aim to Purpose, the radio show, and thank you all for joining us. And we're going to jump right into the show. I hope you all have seen this very, very important film documentary, Forks Over Knives. I saw it. I've seen it more than once because it's so detrimental to us as a nation, particularly since we have, I believe, and we'll talk to our special guest, Dr. Esselstyn, about this, but I believe we have been deemed the nation with #1 death through heart disease. And I think cancer lags directly behind that. So without further ado, we're going to go ahead and introduce Dr. Esselstyn so we can jump right into the conversation. And feel free to call in and ask Dr. Esselstyn questions. The call-in number is 323-522-5482, and we are live from our Global Voice Broadcasting Studio here in Hollywood, California, and we're going to speak with Dr. Esselstyn. So go ahead, and we're going to give you an introduction of Dr. Esselstyn.
And before the formal introduction, I want to play a quick clip of the Forks Over Knives trailer, and that way the viewing audience can get a glimpse of not only the documentary, but the information that is so vital that they can take something away from it. So here's the trailer to Forks Over Knives, and then we'll introduce our special guests for this episode of Aim to Purpose.
This could be the first generation of children in the United States that lives less than its parents.
I got 2 pills I take for my diabetes, then I got 1 for cholesterol, high blood pressure, and then I take Byetta, which is an injectable.
I'm getting really shaky, and I'm sick and I'm fatigued, and that's when they diagnosed me with hypertension and diabetes.
Obesity, diabetes, heart disease, high blood pressure cost this country more than $120 billion each year.
People are saying, you're crazy. You're a cancer patient. You should be resting. Doctors told me this. When I had the second heart attack, the doctor said I should prepare for death.
Heart disease is an absolutely toothless paper tiger that need never, ever exist.
People who were raised in Japan, the Philippines, Korea, China, never had heart disease, prostate cancer, colon cancer, breast cancer, rheumatoid arthritis, multiple sclerosis.
This is the atlas of cancer mortality in China.
Virtually, the Western diet was non-existent. They had no animal products. They had no dairy, no meat.
We learned that we could turn on and turn off cancer growth just by adjusting the level of intake of that protein.
I knew at that point what caused most diseases.
Our national authorities are simply excluding this concept in order to protect the status quo.
With the Western diet, there are going to be 500,000 people in this country this year who will have to have the front half of their body divided, their heart exposed. Some people would call that extreme.
I know of nothing else in medicine that can come close to what a plant-based diet can do.
If you go through life thinking that what happens to you from a health perspective is based on your genes, you're a helpless victim.
I reversed the diabetes. The diabetes is not coming back.
I just can't understand what it's done to change my life.
Diet is so much more important than anybody ever thought.
To me, the answer is so simple, it's criminal. And it's just people starting to take responsibility for their health and starting to eat more plant-based foods. It's that simple.
All right.
Well.
And with the holidays being over now, more people, I believe, really need this information. We always have people that make New Year's resolutions on wanting to become healthy. So this right here will be maybe the answer for many people. So with that being said, Caldwell B. Esselstyn Jr. received his BA from Yale University and his MD from Western Reserve University in 1956, pulling the number 6 oar as a member of the victorious United States rowing team. He was awarded a gold medal at the Olympic Games. He was trained as a surgeon at the Cleveland Clinic and at St. George's Hospital in London. In 1968, as an Army surgeon in Vietnam, he was awarded the Bronze Star. Dr. Esselstyn has been associated with the Cleveland Clinic since 1968. During that time, he has served as president of the staff and as a member of the Board of Governors. He chaired the clinic's breast cancer task force and headed its section of thyroid and parathyroid surgery. In April 2005, Dr. Esselstyn became the first recipient of the Benjamin Spock Award for Compassion in Medicine. He received the Distinguished Alumnus Award from the Cleveland Clinic Alumni Association in 2009. In September 2010, he received the Greater Cleveland Sports Hall of Fame Award. Dr. Esselstyn received the 2013 Deerfield Academy Alumni Association Heritage Award in recognition of outstanding achievement and service, and the 2013 Yale University George H.W. Bush Class of 48, I believe, Lifetime of Leadership Award. Let's see. In 1965, he published his benchmark long-term nutritional research arresting the and reversing coronary artery disease in severely ill patients. That same study was updated at 12 years and reviewed beyond 20 years in his book Prevent and Reverse Heart Disease, making it one of the longest longitudinal studies of its type. Dr. Esselstyn has followed a plant-based diet for more than 26 years. Also, Dr. Esselstyn presently directs the Cardiovascular Prevention and Reversal Program at the Cleveland Clinical Wellness Institute. With that said, let's give a warm welcome as being our first guest for 2015 of Aim to Purpose, the radio show, Dr. Caldwell B. Esselstyn Jr.
Hello, Dr. Esselstyn, and thank you for joining us. We are so pleased to kick off the new year, and we'd like to thank your lovely wife, Ann, for coordinating everything for us to have you on the show. And my son also didn't mention about you and Ann have 4 children and 10 grandchildren, so congratulations and welcome.
So, Louise, thank you so much for the opportunity to share some of my research and clinical strategy with your audience, which sounds very enthusiastic.
Oh, yes. We're so happy to have you here. And with that being said, I just love that the video, Forks Over Knives, because it really speaks to what is happening in our nation today with the heart disease problems, the obesity problem, the cancer problem. And you started doing this research, Dr. Esselstyn. What prompted you to start doing the research? And you started before a lot of the more prevalent situations started with heart disease and so forth back, I believe, was it the 80s?
Yes, thank you. It was in 1980 1984 was when I actually transitioned myself to plant-based nutrition, because the impetus for this study came when I was chairman of our breast cancer task force, and I became so increasingly disillusioned that for no matter how many women I was doing breast surgery, I was doing absolutely nothing for the next unsuspecting victim. And this led to a bit of global research on my part, and it was quite striking to find that there were other nations and other cultures on the planet where, for instance, in Kenya, breast cancer was something like 30 or 40 times less frequent than in the United States. And if you looked at breast cancer in rural Japan in the 1950s, it was very infrequently identified, and yet as soon as the Japanese women would migrate to the United States, by the second and third generation, still pure Japanese American, they now had the same rate of breast cancer as their Caucasian counterparts. So it was really when I saw the prostate cancer death rates in the nation of Japan in 1958, how many autopsy-proven deaths were there in the entire nation of Japan from prostate cancer in 1958? The total was 18, which is perhaps one of the most mind-boggling public health figures that I've ever encountered. But it was along about that time in the early 80s that I decided that I really thought we had to look at the leading killer of women and men in Western civilization, which was coronary artery heart disease, or heart attacks, because it was quite apparent that in many of these cultures that I was reviewing, cardiovascular disease was virtually non-existent. For example, if you're a cardiac surgeon today and you're going to hang out your shingle either in rural China, the Papua Highlands in New Guinea, Central Africa, or the Tarahumara Indians in northern Mexico, you might as well forget it and plan on selling pencils. There's virtually no cardiovascular disease in these cultures. Why? Because the common denominator is that they are all plant-based in their nutrition.
Right.
So this was really quite striking, and it sort of taught me that if we could somehow, my dream was this: if we could somehow get people to eat to save their heart, then they would also diminish the likelihood of having prostate and breast cancer and a whole host of other diseases, as I'll try to demonstrate before the time is up tonight.
That is amazing. And you mentioned coronary coronary heart disease? Can you? There are different. I take it from that. Are there different types of heart disease, and is coronary disease one of the most prevalent? Can you explain what coronary disease is?
Well, I think the easiest way to explain it is the thing that most people fear and is absolutely the most common of heart disease in the United States is heart disease that has accompanied heart attacks. Mm-hmm. Heart attacks are caused by the arteries to the heart, which feed the heart muscle, becoming progressively narrowed and filled up with plaque. And the plaque can either plug the artery itself, or the plaque, when it's small, can rupture and lead to a clot. So what we're really talking about when we talk about coronary artery disease is we're talking about the blood vessels that supply the heart muscle with blood. And that is far and away the most common. It's interesting that the reason that we have this disease, and I have to be a little bit careful here because I don't want to sound like I don't have great respect for my cardiovascular colleagues, which I do.
Right, understandable.
But at the same time, we have really dropped the ball here, and as we continue to treat only the symptoms of heart disease, we're really sort of entering into another dark area of medicine, because basically there's been a covenant of trust ever since the days of Hippocrates between the caregiver and the patient, that wherever possible, the caregiver is going to share with the patient what is the causation of the illness. And today, sadly, in heart disease, that's not being done. So what is the causation of this heart disease that's such an epidemic that isn't even seen in many other cultures? Well, it's a foodborne illness. I'm not going to accept the argument for genes. I'm not going to accept the argument for stress.
That's right.
That the argument truly is what is passing through your lips every day. What are the foods that destroy the life jacket and the guardian of our blood vessel, which happens to be a single layer thick layer of cells, the innermost layer of our artery. And that's a remarkable little blanket of cells that has the name of endothelium. And those endothelial cells are capable of manufacturing an absolutely magic molecule of gas, nitric oxide, which is our great protector. And I'm going to give you four ways that this nitric oxide magically protects us. Number one, nitric oxide keeps all of the cellular elements in our bloodstream flowing smoothly like Teflon rather than Velcro. It prevents those cellular elements from ever getting sticky. Number two, nitric oxide is the strongest vasodilator in the body. What do I mean by that? When you climb stairs, the arteries to your heart, they widen and dilate. The arteries to your legs, they widen and dilate when you climb stairs. That's due to nitric oxide. Number three, nitric oxide will prevent the wall of your artery from becoming thickened, stiff, or inflamed. It protects you from getting high blood pressure or hypertension. Number four, and this is absolutely key, an adequate, safe amount of nitric oxide will protect you from ever developing blockages or plaque, which are the cause of coronary artery disease. So literally, all of those millions of people in this country today who have cardiovascular disease have their disease because they have so progressively injured and destroyed the capacity of their endothelial cells to make this wonderful nitric oxide. They don't have enough nitric oxide left to protect themselves. And in a moment, I'm going to tell you what those foods are that every time they pass through your lips, you decimate and further injure your endothelial cell.
Mm-hmm.
Is that nitro oxide? Is that kind of like an oxygen that keeps?
It's a gas. It's nitric. It's nitric oxide.
Okay.
I've used nitric oxide in a form that's, I don't know if synthetic, for my workouts in the past. I haven't used any powder form of nitric oxide. Nowadays, I typically use nothing but food to supplement my diet versus any type of diet pill or any other supplementation, unless it's a some sort of concentrated food type. I do take hemp protein as a supplementation, being that hemp is a green food and it's one of the more nutrient-dense foods on Earth. Many people, like you've explained, Dr. Esselstyn, many people stay healthy because of the foods that are indigenous to their region or culture. Many people that live near the equator, where the sun is out the longest, people can absorb more energy with the foods that they ingest. And diseases like heart disease, cancer, diabetes, many of these illnesses are self-inflicted because of, like you said, it's the food that the foods that we eat, or the foods that we choose to eat.
Let me try to explain, if I may, why it is that we feel so strongly that it's the food has to be the centerpiece here, because it absolutely couldn't be more straightforward, and it couldn't be more simple.
Right.
What are the foods that every time they pass your lips, you are going to decimate and injure your endothelial cells? They are: one, oil. I'm an absolute hellion on getting our patients to stop the oil, because whether it's olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures the endothelial cell. This has been shown by research time and again, showing that the capacity of the endothelial cell to manufacture and produce nitric oxide is compromised when somebody is eating oil. Number 2, anything that has a mother or a face, meat, fish, chicken, fowl, turkey, animal protein, fat, injures the capacity of the endothelial cell to make nitric oxide. Number 3, dairy, that is to say milk, cream, butter, cheese, ice cream, yogurt, injure the endothelial cell and its capacity to make nitric oxide. All right? Number 4, I'm fussy about avoiding caffeine in coffee. Caffeine in tea seems to be okay, but caffeine in coffee injures the capacity of the endothelial cell to make nitric oxide. And also, be very careful of any excesses of maple syrup, molasses, and honey. Now, what happens is, if we take a patient, for instance, who has so much coronary disease that they have chest pain or they have, which is called angina, we'll find that literally, often, within days of when they absolutely get it and get it right, and they stop eating these foods, since this is not a malignancy, the endothelial cells begin to recover. They recover their capacity to make nitric oxide, and lo and behold, they can dilate their vessel again. The vessels carry more blood, and their chest pain begins to diminish and go away. And it is so powerful and reassuring for the patients to recognize that they have been empowered themselves as the locus of control to halt and to reverse this disease that was trying to destroy them.
Absolutely. Well, I know for sure that what you're explaining works. Everything that you mentioned 1 through 4 is one or all of these things are something that most people will probably say that they can't live without. And because we're here in the Western Hemisphere, we're locked into a fast food paradigm, or we're locked into a processed food paradigm, frozen food paradigm, anything that's total opposite of raw food paradigm, or eating foods that the body can recognize as food over the processed foods, which all of the chemical additives that are added in, the pesticides, herbicides, you name it, all of these substances lodge themselves in either the musculature or fatty tissues, and this is how weight gain can occur, and also heart disease, like you've explained. All of these things, like you said, the meat, dairy, things that we eat every single day, from the beef, the chicken, the pork, the turkey, the fish. All of these things have an adverse effect because we eat too much of this and not enough of our living foods. We're a living entity, which means we need living food to live.
And
It's
that's
fascinating to me
amazing.
that right now, when you think about the fact that this country is being pulled into debtor's prison faster than anything you can imagine by the entitlements, Social Security, Medicaid, and Medicare. What is 45% of Medicare? It's cardiology. What is cardiology? It's imaging, it is stents, it is drugs.
That's right.
And it is operative procedures, not one of which has anything whatsoever to do with the causation of the illness.
Yeah.
And I think that what we really have to... I want to answer a question you made, or actually you said, somebody who said they were unable to live without these foods. Well, a couple, I think, remarks are due to respond to that. One is that there are millions of people on the planet today, as I've just explained, who have lived happily for hundreds and hundreds and hundreds of years without any cherishing of these foods that people so-called cannot live without.
That's right.
I mean, here we have all these nations where cardiovascular disease is virtually non-existent. Now, why are we successful in getting patients to make this transition? Well, I should share with you what that, in a more recent research paper that we just published in the Journal of Family Practice in July of 2014. We looked at some 200 patients who had gone through our program, and we found that there were close to 90% were adherent to our nutritional modifications for them. When we looked more carefully at those 90%, over close to 4 years of follow-up, these are all patients who had significant cardiovascular disease. 99.4% avoided any further cardiac event in that 3.75, almost 4 years of follow-up. If that was a medication or a pill, it would be worth something like $1 trillion to the pharmaceutical house that manufactured it. Now, how do we get that degree of compliance or adherence? Why are patients willing to make this transition? Two things I think are so important here. One is education, and the other is to show the patient respect. Now, if you're going to ask somebody to make this kind of a significant lifestyle change, you must show them respect. And the only way that I know to show a patient respect is to give them my time.
Right.
So I think two things are important. We don't make this education through multiple office visits because 85% of these patients who attend my intensive counseling seminar are from out of state. So we have found out that in one single day, with an intensive 5.5-hour program, we're able to impart to these participants all the information that is essential to them to be able to understand how it was that they created their disease and what they have to do themselves to become the locus of control to halt and reverse this disease. We do this usually in no more than groups of 10 or 12. We always insist that the spouse or the significant other come free of charge. And my secretary will give me a list of the names, usually 2 weeks before the seminar, and I have an opportunity to personally call each of these participants personally myself so that I can get my arms around their story. And at the same time, they'll have an opportunity to ask questions of me so that coming to the seminar, we have a strong platform from which we can all move forward. Now, at that seminar, they're going to learn what I've already imparted to your audience tonight about the importance of the endothelium. And there are very few people who have been sitting there who've already had a heart attack, or they've already had a bypass, or they've already had a stent. And they now suddenly realize that the reason they have their disease is because the food that they've eaten had so seriously trashed their endothelium they weren't able to make enough nitric oxide to protect themselves. How many of them, knowing that, are willingly ever going to leave that seminar and say, my gracious, I endured that first heart attack so much, those nurses were great, I think I'll destroy more endothelial cells and have another one.
Mm-hmm.
Nonsense.
Right.
They're not going to do that, and they are absolutely elated with the fact that they themselves now have the knowledge to be able to know how to do this. It's not going to happen with a drug. It's not going to happen with a procedure or an operation. No, it's going to happen by something that they do absolutely every single day. And that's what's so exciting to me and to those who are part of our team, when you see these patients absolutely begin to blossom as they gain control over their illness.
And that makes a lot of sense, what you're saying, Dr. Esselstyn, because I know for a fact I have a very dear friend that had a triple bypass about a little over a year ago now. And a lot of her eating habits, they have not been good. And I know some of my eating habits have not been good either, but I have been working on it. And what you said so much about education, why is it that, well, you touched on, I think, a part of it, which is the pharmaceutical, that trillion-dollar, billion-dollar, whatever business it is. And I believe that that is part of the situation. And we go to the doctor, they assess our health. And I like what you said about educating the patient and respecting the patient, because all of us want to live. However, are we willing to do what it takes? And it seems like your program,
well, no, I think patients
difficult.
are very willing to do this when they become educated about how to
Right.
make plant-based foods have the same type of delectable and delightful taste. I mean, we have 130 recipes in our book, and my wife and my daughter just finished another cookbook, the Prevent and Reverse Heart Disease Cookbook,
Right.
which is another 130. And it's so exciting to for these patients to realize that they don't have to sacrifice taste or deliciousness in food. And also, when one is going out, it's extremely challenging. But remember, let me just say that although I have a reputation as a taskmaster, I'm not quite as mean as I look.
I could tell that by the film. You were so interested in our health, and we need more doctors like you, Dr. Esselstyn. That's the problem, and that's why we're so happy that you took out your time to come on the show to impart this information, because we are a nation of pill poppers. And almost everybody I know, I'm 63, and I'm not taking any medication. However, with all due respect to the physician and the medical industry, because I worked in it for 32 years with Los Angeles County, not in direct health care, but indirect health care in the Department of Health Services. And doctors are so quick to push medications on you. When I became ill, my doctors, that's all they wanted to do, and I refused to take a lot of the medicines.
That's all we ever really learn in our training, is to make a diagnosis and then decide what is either the pill or the procedure that is going to follow. And that's very, very sad, because what we find increasingly with this, although I'm focusing on our research and focusing on heart disease tonight, the fascinating thing is that as we get close to this entire situation of chronic illness, what I'm talking about tonight, the thing that is so incredible about the optimization of plant-based nutrition, it doesn't only treat heart disease.
That's right.
When you are giving somebody who has an illness like heart disease, and you're giving them plant-based nutrition, they lose their obesity, they lose their risk of stroke, they'll lose their risk for heart disease, they'll lose their hypertension, they'll lose their diabetes that will go away and resolve. If they had rheumatoid arthritis, we find that goes away. The same is true of lupus. The same is true of asthma. The same is true of osteoporosis. The same is true of so many illnesses.
That's right.
When you think about it, if you're going to eat the American diet, that's wonderful if you're going to only plan to live up to the warranty period when you're 25 years of age. But increasingly, what we recognize is that every time we eat these Western foods, our bodies sustain a hit, an injury. Now, you say you can't even perceive that injury when you're 25 or 30, but now you're 35, and suddenly you notice that your doctor says, I think we ought to give you a little blood pressure medication. So you get a blood pressure pill.
That's right.
Now you're 40, and you suddenly said, my gosh, your blood sugar's gone up a little bit. You just got the early stages of diet. We're going to try to control that with early stages of diabetes. We're going to control that with a little diet. But now you're 45, and you're now on 2 pills for hypertension, and you're taking a pill for your diabetes.
Right.
But you gain a little more weight. You keep taking the same food. You have more and more of those hits. And now you're 51 years of age, and you have your first heart attack. It's a small one. It's mild, not bad. You don't need a stent. But you can see where I'm going with this.
Yes.
In other words, the human organism has an incredible capacity to right the ship, and it never has to have this hypertension. It never has to have this prostate cancer. It never has to have this diabetes. These are a combination of foodborne illness. And the reason I'm so passionate about this, even though it's been something like 14 years since I retired from surgery, is that I see us in the medical profession now being on the cusp of what I consider to be a seismic revolution in health. And the seismic revolution in health that we see is never going to come about from the invention of another pill. It's never going to come about from the invention of another procedure or an operation or another diagnostic test. No, the absolute cusp of where this seismic revolution is going to come about is when we in the profession are willing to show the public what is the degree of nutritional literacy that will allow the public to be empowered to absolutely avoid all these common chronic illnesses.
And I agree wholeheartedly with you, because if I had not started researching myself after being on 7 medications and now on none, I could have been one of these people with all of these different pills and taking this medicine. And education is so key. But Dr. Esselstyn, I heard you say that we are moving, I guess we're moving toward many physicians starting to be educated so they can educate their patients.
Not yet. No, it's not. I totally support your thesis, but if I were to tell you that every medical school was now responsibly treating or teaching nutrition, that is absolutely false.
That's right.
So
Yeah,
every medical school should be teaching nutrition. Is that what you're saying?
As long as medicine is being run by the pharmaceutical houses, there's so much money in this. See, right now there are three very strong positions that want to see us fail. One is believe it or not, is our own government. If you look at the United States Department of Agriculture, everybody who is an officer in that organization previously was an officer in either the Egg Board,
right,
the Cattlemen's Board,
Monsanto,
the Dairy Association, the Egg Board, and so forth. And here they are in a position of leadership, and they are the ones that prepare the American food pyramid, or the plate that is suggested every 5 years for Americans. Well, what's on the plate? On the plate are those very foods that if millions of Americans are going to perish if they eat that plate.
That's right.
So it's not about our health.
You cannot depend on your government,
right,
to really to save you in this situation. Number two, how about industry? Well, what about the statin drug industry? That's $35 billion. Do you think they want to see this epidemic go away?
Of course not. Of course
not.
not.
What about the stent industry? That's $5 billion. Are they wanting to see it go away?
That's right.
And then, of course, we have my own colleagues who are doing lots of stents and lots of bypasses. Are they clamoring for fewer and fewer patients?
Right. It's their business to do what they do, no, whether the patient gets well or not. I mean,
so until we create an economic environment where physicians can be rewarded for teaching patients, and I think that one of the things that's so difficult for physicians who hear what I'm doing, they say, well, how in the world do you expect me to have 5.5 hours with every one of my patients? Well, we don't expect that, but what we can ask them to do is the following. Maybe every Wednesday afternoon, every other 2 weeks, they can take a panel of their patients and do the same thing over 5 hours, or as one of our colleagues has done, he does it on a Saturday morning. He takes the patients in his practice who are at risk for this, and they give them the full bore that we've had an opportunity to share with them.
And that is so true, Dr. Esselstyn. It's about big medicine and big government, and that's why I'm encouraging everyone to get the documentary Forks Over Knives, and also to get your book, Prevent and Reverse Heart Disease, because it's been proven that it can work. And I know from my own health, getting off the medications, I felt better, exercising, and so forth. And I don't have I have a heart murmur. I've had that since I was 12. I don't know whether that's considered heart disease. I'm not sure. Is a heart murmur considered heart disease?
Well, it would always depend upon what kind of murmur it is, and that's something that is analyzed on an individual basis. So it's pretty hard to say it. I think that my gut reaction would be that if you're 63 and you've had this since you were a child and doing well with it, it probably is not very symptom.
Yes, I guess not, because I've had it since I was 12, which was my first time going to a doctor. And what would it be? What would you say if doctors were more trained in nutrition? And is there, with your program, are there referrals from doctors to refer their patients who? Because we saw in the documentary.
Oh yeah, I have a secretary, and we have. Secretary, telephones, all the usual stuff. And I work at the Cleveland Clinic Wellness Institute, and people called Jackie, my secretary, all the time and asked for an appointment. And we're very accommodating.
And one thing else I'd like to say, in watching you in the film, and I've seen you on other programs and so forth, there are a lot of doctors, again, with respect, they are telling you to take these medicines and do that, and you're looking at them with their health, and with you being proven with this plant-based diet or better way of lifestyle living, it makes sense, because I look at your statute and I see a healthier person than some of the doctors I see that appear to be doing the same thing. I guess that's the average person is doing, just eating the meats and all the other things that you mentioned, the oils, the meats, the dairy, the caffeine. Now, some of the patients I notice, if they drop out of how do you encourage them to stay into the program?
Well, as I mentioned, we're very proud of our adherence rate of close to 90%, which is almost unheard of. And we think that's really very powerful. As far as I'm concerned, I'd like to take that and take it up to 95%, even higher. And because, after all, this is America, and people do have the opportunity to make choices. And some of these people, the very, very few in the minority, really choose to continue to eat the same way. And, of course, they have much more in the way of continuous and progressive disease, which often has, unfortunately, disastrous results. Because if you just can't keep having heart attacks and having more and more of these procedures.
That's right.
But the whole, I think that many people in medicine will say that that they will recognize and accept the fact that our research works. But their criticism will be that they find that patients won't comply with it. So when I talk to them, I say, well, can you share with me in a 20-minute office visit, how much time do you give to the patient to explain to them this nutrition that you want them to follow? Is it 5 or 5.5 minutes? Yeah, if I'm not lucky. So they'll get 5.5 minutes. If you think that you're going to change somebody's behavioral modification and their lifestyle with 5.5 minutes of education, you're a dreamer.
That's right.
You're absolutely a dreamer.
I agree with
and
that.
This is why I've said time and again, it's not that the message is wrong. It is how the message is articulated.
Yeah.
And and when you think about it, in the best of all worlds, what will happen is the following: that if we can get this away from the USDA, and we have control over the food that goes into our schools, as soon as we have children beginning to eat this way, the children will teach the parents. And suddenly, as they come up through adulthood with a full understanding and recognition of how healthy it is that they've been eating, then it'll be automatic. They won't have to be changing. They won't have to be talked into changing their lifestyle. They will already be following the lifestyle that is just like these other cultures where the disease is non-existent. The idea is not to feed people these horrible, delicious foods that are made of animal origin until they begin to crumble and then try to destroy the wealth of the nation, trying to bail them out of these illnesses that they need never have developed in the first place.
Right. And with that said, Dr. Esselstyn, stay right there. We're going to take a quick break, and then we're going to come back. Dr. Caldwell Esselstyn is our guest, and we will be right back, and we're going to talk about the cookbook and then have some final thoughts, and then I have a few words that I'd like to say as well. So we're going to take a quick break, and we will be right back.
This edition of Aim to Purpose, the radio show, is brought to you by L. Hicks Consulting Services. When you want the best in business coaching, life coaching, or perhaps your organization, business, or company is in need of a dynamic speaker for an upcoming workshop or seminar, contact Louise Hicks for L. Hicks Consulting Services at 1-562-310-1495. From anywhere around the world, that's 1-562-310-1495. For more information about Louise Hicks and her consulting services, visit her website at www.louisehicks.biz. Again, that's www.louisehicks.biz. Or call 1-562-310-1495. L. Hicks Consulting Services, where professionalism is top priority.
We're back, and we have about 5 minutes or so left to speak with Dr. Esselstyn. However, we're going to continue this conversation next week with Ann and Jane, Dr. Esselstyn's wife Ann and his daughter Jane, and we're going to talk more on the subject because it's such a needed subject. And I just wanted to make a quick quote, Dr. Esselstyn, that I picked up out of the Forks Over Knives documentary, because I think it's so important for people to be educated and understand, because you need to take your health into your hands. And Ken is holding up a copy of the Forks Over Knives documentary, and I ordered the book as well, both the cookbook and Dr. Esselstyn's book. I didn't get it yet. Hopefully I'll have it by next Monday. But this says 1/4 of what you eat keeps you alive, and 3/4 keeps your doctor alive. Now that's something for you to think about, because we should be wanting to keep ourselves alive and invest in us. And Dr. Esselstyn, just tell us, I had another question about what do you think we as the public can do to help our government to enforce to them that our health is what matters and not fill in the pockets of big government and big medicine. What can we do as the public?
Well, I think that's an excellent point. But I can tell you that having gone 4 times to Washington to try to get changes in policy there, I learned very early that really I was like a puppy in the deep grass down there. That's an absolute jungle, and Washington will never lead, but it may follow. What really we have to do is hopefully the people who are interested in this, and especially some of the scientists, we've got to keep publishing outcomes that make it so embarrassing to the entire profession to even think about keeping going with this ridiculous approach on symptoms and trying to really treat what is a metabolic disorder by a mechanical approach. And there was one other thing that I think was very exciting. I remember in Cleveland, we didn't succeed, but I still think that for the African American community is particularly carrying a huge burden of the common chronic killing disease of hypertension.
Yes,
obesity,
we are.
Diabetes, heart disease, and strokes.
Yep.
And it just seemed to me that if we could somehow get our program into the churches, I think often in this particular community there is a great deal of strong leadership on the religious side, and if we could somehow get that information through that as a conduit of education, we could get this ball rolling and begin to sort of turn this around.
Well, Dr. Esselstyn,
Yes.
I agree with you. However, that's why I started this radio show, so we can have a voice and help people. Being a black person myself and going into the churches, that's a difficult task as well, because people, and I'm black, and I can say this because we are so ingrained, and that's why many of us are obese, and we have this problem because we're not being taught. Many of the religions they're like the government. They're all about the greed. The religious establishments, they aren't concerned about their congregations, many of them. They're more concerned about what they can give them in terms of the money. So that's a difficult task as well. But we're going to have some people on our show to tackle that issue as well. And I'm glad you brought that up, because that is something that need to be addressed in the black church, since we suffer from hypertension, and I don't have any. I'm at 63. Like I said, I've never had hypertension, but I've always been health conscious, and probably that has to do with my upbringing, being raised in Louisiana and eating a lot of plant-based, because there were days on days we didn't even have meat on our menu, which was a good thing. Probably a lot of it we couldn't afford it, but it was a good thing because we raised a lot of our food. So I'm glad you brought that out, and we will be addressing some of that. Now, our Shamika has a question for you, Dr. Esselstyn, quickly.
Hi, doctor.
Hi, Shamika.
Well, I wanted to just ask a question. I actually was diagnosed with diabetes back in, about a year ago now. And the medication that the doctors prescribed, some really crazy side effects. And so my question to you is, someone who is in fact wanting to transition, but, being told that if you quit taking the medicine, it could get worse. Can you kind of dispel some of that stigma and really clear the air on that, please?
Yeah, can I ask how old you are, how tall you are, and how much you weigh?
Oh, no.
Tell it, Shamika. Tell it. Lay it out
for the sake of the people. For the greater good. Okay.
Did they tell you your diabetes that you have is type 1 or type 2?
Type 2. But I'm 30. I'll be 33 this month.
Yeah.
And I'm about 5'7" and a little over 200 pounds.
Okay.
Did you hear that, Dr. Esselstyn?
Here's what's going to happen. If you ever decide to come and go to our intensive counseling seminar or read our book and go plant-based, totally go plant-based, you will find that several things are going to happen. As you begin to lose weight, be sure you're always checking your morning glucose.
Okay.
Because as you begin to improve and your diabetes begins to go away, the medication you're taking will be too much. And we don't want you to get your blood sugar to go too low.
Okay.
So that's why if you check it regularly every morning, you'll find if it starts to drop much below 100 or below 90, then you're going to begin to shave back the amount of medication you're taking.
Okay.
But what that will immediately tell you is how absolutely powerful this approach is for getting rid of your disease.
That's right.
Okay.
And you'll have to continue that, and you continue that until, and I won't. But if you at your height get yourself down somewhere around 135, 140, you're not going to have any diabetes.
That's
Praise
right.
them. Well, that's exactly what through my own research.
But right now you have no nutritional quarterback.
Okay.
Okay. and Dr. Esselstyn, she needed to hear that.
Because although I'm as firm as I am, I'm not very mean.
Yes. Well, and I was the person who made the comment about all of the stuff on your list. I absolutely love it. When I think about my diet, caffeine is on there. I love turkey bacon, so everything,
well,
you give up.
Male, if you love the idea of getting dementia.
No. But
if you're male, you love the idea of erectile dysfunction. Keep eating that crap.
No, but this is why education is important. And then really to piggyback off of Luis was saying about the church, I think just in the African American culture in general, soul food. We love all of the stuff that's packed with sugar, packed with oil. It's like kind of really re-educating yourself and just throwing everything that you know out the window. So thank you for that.
I always say that soul food is
we have had many African American patients, and they have totally succeeded in throwing away that garbage.
Well, I, for one, am interested in joining the program, so I'd love to talk with you off the air. My only other question in regards to that...
Got to make it quick, too.
Yes.
Because we've run out of time. That's why we're having you back next Monday.
Thank you one and all, and it's been a real privilege for me. Thank you.
Hold on. She has...
I just wanted to ask about insurance. Medi-Cal, Medicaid, or how does that kind of play?
Do you take any of that for your program?
Oh, my secretary is the one who knows all about
that.
Okay,
usually that's how it goes. You talk to the paper people and the people that handle all that.
Well, thank you for answering the question, Doctor.
And we that's the only thing about our program. We have an hour, and that's why we wanted to go and talk to you. And we're going to talk to Jane, and hopefully you can be on with Jane and Ann next week because Rip won't be able to come, your son, and we're going to have him on a separate show. But we're going to continue this conversation because it's vital that we all learn how to protect ourselves and take care of ourselves. Like I said, I'm not on any medicine, and thank God for that. And I'm not obese. I ate a lot over the holidays, so I need to lose a little off of my 150-pound skeleton that's 5'3".
Thank you, Louise. Good night.
Thank you so much.
You.
Good night.
Bye-bye.
And with that, we will end this by saying...
Your power lies within you. And until next week when we come back to continue this conversation, have a great week.
Bye.